This patient was referred to me for endodontic treatment of tooth number 31 after his dentist had already tried to do the root canal. So you can see that there's a temporary filling in the tooth, cotton pellets here, and you can see that this dentist unfortunately went too far down to try to locate these canals, and he was able to locate 3 out of 4 canals, and then in the middle of the procedure to temporize the tooth and refer the patient to me. From the look of tooth number 31, you can tell that it kind of looked like probably maybe even worse than number 30. You can see how calcified tooth number 30 is. So tooth number 31 was probably as calcified, or perhaps maybe even more calcified of tooth number 30. So that's why it's very important to know your limitation before you start. So if you see a tooth like this, don't just assume that you can do it. You need to have had experience on extracted teeth. You need to hundreds of extracted teeth, practice on hundreds of extracted teeth, and you also need to have had experience and have the knowledge to be able to use a surgical operating microscope or very strong loops and strong light to be able to see. You need to have ultrasonics. You can't just go with dental burrs to try to locate these canals. And you can see those burrs are usually very aggressive, and something like that can happen. Anyways, so went ahead and removed the temp, removed the cotton pellets here, and immediately noticed a perforation from the buccal to the lingual. Was a line, a perforation line, as this dentist had troughed the pulp chamber floor to try to locate the canals. And that trough from the buccal to the lingual, that whole area it wasn't like a pinpoint perforation. It was a line from the buccal to the lingual perforation. It was a pretty deep line as well. So I was able to immediately locate the canal that this dentist couldn't find. I believe it was the mesiolingual canal that he couldn't find, and went ahead and did the root canal and then repaired the perforation with MTA. So take a look. As you can see, everything went beautifully. Look at the curvature of these canals. So 2 mesials and 2 distal canals. The distals join, the mesials are completely separate, as you can see. That's where the perforation was. Again, from the buccal to the lingual, a line basically of perforation from buccal to the lingual. So we went ahead and temporized the tooth and referred the patient back to his dentist for the permanent restoration. But as I said, make sure that you know your limitations, and don't use the patient to practice on.